This is Dr. Carol Heinrich, and we're going to be talking about the overview of gerontological nursing. This is the first part of Learning Module 1. The first few slides talk about the history of gerontological nursing. As far back as 1966, the American Nursing Association has established the Division of Geriatric Nursing Practice. And this has further identified that nursing and healthcare professionals, nursing in general, need to refine their skills with assessment, performing interventions, and evaluating the care provided for older adults. So this is going back about 50 years ago that this need has been identified, and much progress has been made over the last 50 years. 1989, the clinical nurse specialist was identified as a need, and again, it was based on the specialty of gerontological nursing. The American Nursing Association also developed standards of practice, and the standards of practice are the best practice for the care of older adults that is definitely based on evidence from the literature. Again, standards of care, standards of practice are the goal for the optimal care for nursing care of older adults. So this is what everybody who works in clinical practice settings caring for older adults should model their practice after. There's many roles that nurses take on in providing care for older adults. The first one on the slide is the generalist registered nurse. So again, all of you taking the course are registered nurses, and you have worked in clinical practice settings either as a registered nurse or as a student, and I can make a good, strong guess that most all of you have provided care for older adults in the clinical settings. Again, this is why content and refinement of your skills in addressing the needs of older adults is critical in order to provide the best care. Advanced practice roles for gerontological nursing are the nurse practitioner and the clinical specialist. There are many terms that are used in gerontological nursing, and again, I want to point off right off the top that your book refers to this as gerontologic nursing, which is the focus on nursing care of older adults. But in my education, in my experience, I always use the word gerontological nursing, which means basically the same thing. There is controversy over what term is the best to use, so again, you'll see these terms used differently in different literature or different research studies, and even in different textbooks, and even talking among nurses ourselves. All right, next we're going to be talking about the demographics of this patient population of older adults. These characteristics are very important as we plan care for older adults based on our assessment findings, as well as evaluate. In order to provide the best possible care, we need to consider the characteristics or the classic picture of older adults. Okay, the population that of people who are older than 65 has increased over the years on a steady increase. But again, they expect people older than 85 years is going up to be 56 million by 2020, which is a great increase in the older population of the older adults. Again, you can think of 1 in 8 persons today is an older American. Why is the increase out there? Again, just think over the years, for the last 50 years, there is much improvement in healthcare, vaccinations, antibiotics, environmental conditions. Infant and child mortality has also decreased, so the number of people living through older age is much higher. Really based a lot on common sense. All right, again, you've always most likely have heard in the media, in the literature, and in talking to people that women usually live longer than men. Again, according to the statistics in 2012, women still live 20.3 years after the age of 65 as compared to men living 17.4 years after the age of 65. That gap that was out there 10, 20 years prior to today was a little bit larger than that, and we're seeing a narrowing coming down as everybody is aging together now. Again, the minority in the older adults is increasing and expect to be a 50% increase by 2020, which clearly reflects the general population here in the United States. Aging in place, again, talks about older adults as a group, prefers, and you'll find them living in their same home environment, very limited changing in residence. I can just give you an example of my own parents. Again, I come from the New Jersey area, and both my mother and father both were born in the same town, worked in the same town, and they spent their entire life in that same town with never thinking of moving elsewhere. Again, you're going to find that of a lot of the older adult populations. Then again, you have some older adults, once they hit the 65 or the retirement age, do move south or into the Sun Belt states for the better weather, warmer weather, less snow, less ice. And again, that means they're leaving their family, they're leaving their home environment, they're leaving their friends and the routines and things that they're accustomed to. They move down to a Sun Belt state like Florida, Arizona. And again, they stay there for a few years. Some do stay. Obviously, some do stay here in North Carolina. We have a large older adult population in the Wilmington area because it's a Sun Belt state. But there are some older adults that do move back to their home states, their home place, after a few years being in the Sun Belt states without their family and friends. We call that counter-migration. This is a map that shows people 65 and older as a percentage of the total population. This is dated from 2011. You can see, you would expect the dark blue is the highest proportion, 17.6%. Again, and here is your dark blue. Florida, Arizona are considered Sun Belt states. South Carolina is a large number of retirement people, and here's North Carolina, which is the next color down, which is 13.9%. Again, it makes you wonder why people up here in Montana, North and South Dakota, Maine, the New England states, these are the older adults who have decided to stay and remain in place, aging in place. Again, here's a key factor. Again, this is information for most of you to review on your own, but only 3.6% of the people older than 65 live in institutional settings, such as subacute or long-term care settings. But again, as this group of people age up to the age of 85 plus, that percentage goes from 4% all the way up to 11%, which makes sense as these chronic illnesses keep on progressing and maybe having some more complications, and their functional status is being impaired, is when they will be moving into the institutional settings. Educational level of older adults has increased. Again, in 2012, up to 24% had a bachelor's degree or higher, which is a very important piece as we work with them into maintaining their health status and healthy promotion of health. Again, my research area of interest is health literacy. Health literacy is the ability of a person to understand the health information presented to them by healthcare providers. It could be in acute care settings, on discharge, on admission, or it could be in primary care settings in physicians and nurse practitioners' offices. So again, there's a very close, tight relationship between educational level and health literacy level. Health literacy is a known factor that the higher the literacy level, the better the outcomes for that patient would be. May it be less hospitalizations, better control of the chronic illness, whatever the health outcomes have been identified as, there are better health outcomes as someone's health literacy level is higher. So again, in the older adult population, I've done quite a bit of research on health literacy in older adults. And again, you have to take into consideration the cognitive deficits that some of the older adults may have. So again, even though their educational level could be up at a bachelor's level, some of the neurological changes and vascular changes that take place may have a direct effect on the health literacy level, which will then limit their understanding of the information provided by the healthcare providers. Just one piece again on this, it's a very small percentage of people, maybe only 8% of the people fully understand what is taught to them in their discharge instructions and teaching done by healthcare providers in an outpatient clinic setting. Older adult is more of an issue than younger populations. A lot of older adults remain working after the expected retirement age of 65. And again, society and economic changes today have a great impact on the number of people who continue working. Again, here's a piece of information that is a key critical factor that you must understand in order to be successful in this course. So again, old age is not synonymous with disease. So when you think of an older adult, don't always think of an ill person. All right. Down here it says many people older than 65 have at least one chronic illness, and many of them have multiple conditions. Even though a person could be diagnosed with diabetes and hypertension, they can still be healthy. Again, remember, healthy is not defined as the absence of disease. Healthy has a lot to do when working with older adults is to their functional status and how well those chronic diseases are managed. So again, even though this person has diabetes and hypertension, on the health illness continuum, they could still be up on the health side. As long as their diseases are managed effectively, they can still be up on the higher levels of health. Functional status is an important concept also. Again, studies and research shows that as long as a person maintains their functional ability to care for themselves, to manage their health issues and concerns, it will delay or even never have to face the idea of institutionalization in long-term care. So functional status is what we work as nurses in trying to promote and maintain functional status for our patients. There's a lot of different assessment tools we're going to be talking about and a lot of interventions geared on helping these people maintain function. This slide addresses the common illnesses that we see in older adults, but just keep in mind that these are people not living in institutions. This list of diseases here are the common ones. And as you can see, these are all chronic health issues. A lot of them can be managed effectively through outpatient clinic settings and doctor's offices. Some, possibly like cataracts, orthopedic problems, may require surgery, but it could be either as an inpatient, outpatient, short-term stays, and they could be back into the community-based settings in which they live. The leading causes of death are these three: heart conditions, cancer, and cerebral vascular diseases. Very common health causes of death, even we see in other populations. What we don't see is accidents as a leading cause of death, as you may see in the middle age and the young adult or younger. Now we're going to talk a little bit about finances. Again, we're going to be your book goes into quite detail about the finances and how it relates to the health care. But again, I just want to bring up the main issues related to health care and funding for insurance for the older adults. The Affordable Health Care Act, which has been in the news quite regularly on a regular basis for the last few years, again, usually relates to people younger than 65 years of age. Once a person hits 65 years of age, they are covered under the government-funded Medicare and health insurance. So the Affordable Care Act, I have included it on this slide, is because, has anybody ever heard of the donut hole? The donut hole has to do with the prescriptive drug coverage for older adults. Again, down on the side, it's Part D, which is an optional, and older adults have to pay a supplement for the Part D. It covers most prescription drugs, but if someone's on a lot of medications, especially if they have 3 or 4 chronic illnesses, they may use up the money that is set aside for prescriptive drugs. So then they have to go on and pay out of pocket, which was this donut hole, and it could be very expensive. These are hyperlinks. You can click on Bridging the Coverage Gap, and that refers to the donut hole. Let's go back up here. The Affordable Care Act has a clause, a statement in the plan that eliminates the issue of the donut hole. Again, this is just the Medicare insurance, and again, these are hyperlinks and you can click on it. This is hospitalization. Medical insurance is lab testing, doctor's office visits, x-rays, things like that. The next thing talks about the nursing practice skills that are required by nurses. You can look through these. There's 5 of them. These reflect the standards of care and the expected scope of practice for people working with older adults. These 5 issues or concerns or items guide the development of the course that we're going to be working with throughout the next few weeks. All right, ageism. Ageism is there and out there, and again, I know your first discussion for this module relates to poses questions related to ageism and the bias that we see for older adults. Again, the Alliance for Aging Research in 2013 conducted a review of the literature and interviewed people and found that ageism is a critical problem in healthcare providers today. You can just read over these slides, and again, as we work our way through the discussion and in your readings, we will be addressing ageism in much more detail. Please let me know if you have any questions. Again, this is Dr. Carol Heinrich, and thank you.